Okay, good afternoon, everyone. It's my pleasure to welcome you to the Health in the Public Interest Seminar. This is, I think, the third in the spring series, and we have some great seminars coming up. So watch for future announcements, which will include someone from the Prison Justice Initiative at Georgetown that we just recruited to do a seminar later in April. We have Dr. Tony Fauci giving a seminar in March, and we have an outstanding speaker today. So join us each week, and we're really happy to see you here. So the Health in the Public Interest Program is a program that looks at the social determinants of health, the effects of culture, poverty, environment, anything that's basically non-medical, those influences on health and healthcare. And we specifically don't shy away from promoting advocacy. So a lot of academic programs stay away from advocacy. We are looking to train people who want to be change agents in the health system, not simply filling a role that's already defined. So if you're interested in our program, we'll put up the URL in chat, and you can go and look for yourself what we do. And there's also links to previous seminars. So we have a student moderator today, Tony Booth, who's going to introduce Rachel Taylor, the speaker. The run of show will be after that introduction. Ms. Taylor is going to do her presentation with a couple of breaks for various other things during it, and then we'll go to questions from students and then the larger audience. So we'll keep everybody muted for now until and unless Rachel encourages us to unmute people for one of her things. And again, welcome Rachel, welcome audience, and I'm really looking forward to this. Tony.
Thank you so much. Oh, sorry. Thank you so much, Dr. Myers, and thank you, Rachel, for being here and presenting to us. With our brief interaction with each other, I really enjoyed speaking with you and learning a lot from you. And I can't wait for everybody else to learn from you as well. So Rachel Taylor serves as a senior global health advisor with Save the Children US, where she currently works at the intersection of climate change, health, and equity. During her 14 years with the organization, Rachel has led and supported large development programs focused on strengthening community health systems, advancing health equity, and translating evidence into practice to reduce maternal, newborn, and child mortality in over 20 countries. Before joining Save the Children, Rachel worked in the humanitarian health sector for 6 years, where she collaborated with teams in post-conflict and protracted emergency settings to avail primary health care, mental health support, sexual and gender-based violence prevention, and nutrition programming to vulnerable populations. She's gained invaluable program implementation experience working in Kenya, South Sudan, and Uganda, and to date has provided technical assistance and management support to health programs in Colombia, Egypt, Ethiopia, Guatemala, India, and several other locations. And fun fact, some of her favorite projects were in Egypt and India. Rachel began her public health career at a community clinic in Los Angeles serving low-income immigrant and unhoused populations. She holds a BA in anthropology from Grinnell College, a certificate in climate change and health from Yale University School of Public Health, and in 2019 completed the Women's Global Leadership Program at the Center for Strategic and International Studies. Rachel also lives in the DMV area, and she's also a master naturalist. So if anyone would like to ask her about that, it's very interesting. So Rachel, I'll have you conduct your presentation.
Great, thank you. Well, good afternoon and good morning, good evening if you're joining from other time zones. First of all, thank you to Professor Myers for this invitation, to Tony for the introduction and for our chat last week, and Elizabeth for the meeting logistics. And I think Elizabeth will be running the slides. So I just want to ask if you can pull those up and confirm that everybody can see that. I can.
Yep.
Okay, great. So thank you. I'm really excited to be here, primarily because you all are working in a program that sounds fascinating and it sounds very well aligned to the work that I do. And had I known a program like yours existed a number of years ago, I probably would have taken it. So I'm really excited to be able to speak with who I assume are like-minded folks, and to share experiences with one another. Thank you also, students, in particular, for those of you who responded to my survey questions in advance. Your responses have actually shaped part of what I will share and hopefully what we'll discuss today. So my hopes for the session are threefold. By the end, I hope that you will have a better understanding of how climate change affects health. I hope that you will appreciate or begin to appreciate how health risks associated with climate change are not equitably experienced or distributed. And really importantly, and I mean this, I hope that you won't lose hope, because while climate change poses a real existential threat, there's no question, I do believe that we can meet those threats, and that if we take action that centers equity and justice, that's not just sort of a moral imperative to how we do our work. I actually think that's the best way to work and to realize results. So with that in mind, let's get started. Next slide, please, Elizabeth. Okay, briefly, here is our agenda for today. And as Dr. Myers mentioned, we're going to take a pause in between the challenges section and the desired impacts and promising solutions sections, that you can ask some questions, because I admit, though I tried to keep this light, I have a lot of information to share. So I'm going to try to give you a chance to ask some questions that might help clarify your understanding before we move into talking about solutions and how we can take action together. All right, next slide. So first, oops. I think you've jumped us ahead, Elizabeth. It's okay. We want to go back to the slide right after the agenda. But this is good. You're getting a preview of coming attractions here. All right, one more. Oh, there we go. No worries. It wouldn't be Zoom without some glitches. Okay, so first of all, I have to say a few words about Save the Children, just because that's where I work and that's where I've spent almost 14 years of my life now. So first of all, Save the Children, you've probably heard of us. We are a massive global organization now, but we have the distinction of being the world's first and now the world's largest independent children's rights organization. And our founder, who was a woman, a British suffragist named Eglantine Jebb, she holds the distinction of actually developing what is the first draft of what eventually became the UN Declaration of the Rights of the Child. She wrote that in 1923. And since that time, we as an organization have worked to uphold it, and we've grown, obviously, over the generations. And we are a global movement now, partnering with communities and private sector and government and other stakeholders in over 100 countries around the world, all in order to, what we want to achieve is a world where every child can thrive, can grow up healthy, can be educated, can be safe, and look forward to a future full of promise. And with that in mind, I'll just say a few words about the sort of grow up healthy ambition, because that's what drives my work and our team's work within the Global Health team. We've got work across the world in over 40 countries, primarily focused on reproductive, maternal, newborn, child, and adolescent. It's a mouthful, RMNCA, health nutrition. Those are the populations that we primarily focus on, and with a particular emphasis and interest in those who are most vulnerable or who have been marginalized by the system within which they live. Okay, next slide. So to get us started, what is the relationship between climate change and human health? This was one of the questions I asked students in advance, was to share with me how they see that relationship. And to answer that question, we're actually going to take a few steps back. So next slide, please. Human activity is simultaneously affecting our natural systems, our biophysical systems, as well as socioeconomic trends in multiple, complex, and interconnected ways. And this graphic shares how much human activity has affected the world just since 1950. So you can see that our population has almost tripled. Our real global GDP has increased 7-fold. Fresh water use has increased more than 3-fold. Primary energy use 5-fold. And fertilizer use for agricultural practices more than 10-fold. So in total, this human activity has had profound impacts on the Earth's natural systems, biophysical systems, resulting in rising levels of greenhouse gases, as we know, a warming planet, ocean acidification, resulting in dramatic losses of fisheries, forests, and biodiversity. And altogether, this is what Will Steffen et al. In 2015, described as the most rapid transformation of the human relationship with the natural world in the history of humankind. And we know that these dramatic human-driven changes threaten our health and well-being, both now and they're projected to do so into the future, unless we take action. Next slide. So being Save the Children, when we look at this, all these human-driven changes and threats and the climate crisis in total, given our mission and history, we see the current climate crisis as a child rights crisis. And under the current conditions, including countries' current Paris Agreement commitments to reduce greenhouse gas emissions, under these current conditions and commitments, a child who's born today will experience on average twice as many wildfires, over 2.5 times the exposure to crop failure, 2.5 times as many drought events, almost 3 times as many river floods, and 6.8 times more heat waves across their lifetimes compared to a person who was born in 1960. That's massive. And I note that in some of your survey responses, you also, students were remarking on observed marked changes in seasons and weather patterns in your own lifetimes to date. And we know data show that children, particularly in low and middle income countries, already are and will continue to bear the worst impacts of these climate change hazards and stressors. And within those children writ large, we know that the impacts on some children will be greater. Those who are living through conflict, who may be experiencing inequality or discrimination on the basis of gender, disability, displacement, or other factors. And then this is where sort of the social justice angle comes in. At the same time, these communities in these contexts have typically contributed the least to the greenhouse gas emissions that are driving climate change. Next slide, please. So now let's narrow in a bit and look more at health and climate change specifically. So climate change, its effects are, as you can see in the slide, complex, non-linear. They can be direct. So for example, injury or death resulting from flooding, from heat waves, from other extreme weather events. So they can be directly caused by those hazards. They can be indirect, many of them are, resulting from vector, food, waterborne disease, which is worsened or exacerbated by the effects of climate change, the effects of undernutrition, poor air quality. So they can be indirect in that fashion. And they can, and almost always are, socially mediated. So they are the other underlying social determinants of health, which I understand is a part of your course of study, understanding those social determinants, other socially mediated factors like conflict and displacement can all have an additional effect. And I'll draw your attention to this graphic on the right, which is from the World Health Organization, WHO, which provides a nice visual overview of climate-sensitive health risks, which are in the center, encompassing everything in that sort of yellow oblong shape. That's inclusive of exposure pathways, vulnerability factors, and then together how those lead to, down below, particular health outcomes that can result. And this is obviously on a very general global scale. How this looks in any given country context or community will differ. Next slide, please. So to kind of unpack that yellow health risk bubble from the previous graphic, here's a somewhat simplified equation to help us understand these relationships. So if we understand that there are sort of three main elements that add up to a health risk when it comes to climate change. Health risk is on the left, and our three ingredients are on the right. Those include the nature or type of the hazard, the extent and the nature of the exposure to that hazard, and then underlying vulnerabilities. And I'd like to walk us through an example that actually was provided by one of you. And I probably should have sought consent beforehand to share this. There are no identifying, personally identifying information here that I'm aware of. So this is the example. And I'm going to ask each of you to be thinking about, when you hear this example, what is the hazard, what is the exposure, and what is the vulnerability? This student shared that the impact of wildfires last summer showed me how weather and climate impact health. On some days, the air quality in the DC area was so bad that it made it difficult to see through the air. And I had to forego my usual exercises for fear of inhaling the ash-filled air. Because I have asthma, I was especially wary of the air quality. Just walking to and from the metro made me cough. All right, so just take a moment and you can put it in the chat. What do you think in this case example is the hazard, climate hazard? What is the nature of the exposure, and is there an underlying vulnerability? And I will not be able to see the chat, so just please chat away. And I will share that the hazard is smoke from wildfires. And there's a whole other conversation we could have about how wildfires are being made worse and more frequent by the effects of climate change, but that's not part of this equation right now. So the climate related hazard is smoke. And that's dangerous because it consists of really, really fine, small particulate matter that gets into your lungs and into your system really easily and can cause adverse effects in all kinds of ways. And there's lots of research on that that I could point you to later if you're interested. So that's the hazard. Yes, PM 2.5, exactly. The primary exposure for this individual is being outside, it sounds like, while commuting to work or to school. This individual is making choices to limit their exposure by not, going outside to exercise. But they can't avoid exposure to this wildfire smoke entirely in the course of their day. And then the underlying vulnerability for this person is their health stat, their existing health status. They have asthma, which is very common. And we know that asthma is activated and exacerbated by this type of hazard. So in total, this person faces a greater potential health risk from wildfire smoke than somebody who is similarly exposed but without asthma. So now let's think about, when we're thinking about equity and how equity fits in, what if this vulnerability factor, asthma in this case, would be further compounded by other inequalities or inequities associated with gender norms, race, disability status, socioeconomic status. Go to the next slide, please. Inequities function as a risk multiplier in effect. So in this example, what if the individual is an uninsured day laborer with poorly managed asthma who has to work long hours outdoors? Or perhaps this individual is a 4-year-old child with asthma who lives in a home without functioning air conditioning, so the windows are left open for airflow and cooling. both of these individuals have underlying vulnerabilities or have increased exposure, pardon me, by virtue of the work that they do or the housing condition in which they live. In addition, being uninsured, our day laborer might not be able to afford the cost of preventive care to manage his asthma, or he might not be able to afford the time that he needs to spend waiting at a clinic to be seen. Our 4-year-old with asthma, who is too young, to be enrolled in school, and whose family cannot afford a new air conditioner, let alone preschool or daycare. This individual, her exposure is increased, and she's also exposed to more extreme heat, potentially, which could also take a toll on her young body, which is less able to thermoregulate. So these are just examples that I've sort of added to the one shared by one of your colleagues to demonstrate that inequities, even within that broad sort of equation of how health risks are calculated, and inequities will make those risks potentially worse. All right, next slide, please. Okay, so let's talk about let's drill down to some more examples. And I think many of you cited these, some combination of these in your responses. Increased heat, and actually, yeah, that's fine. Increased heat in the upper left quadrant. We know that can lead to heat stress. It can affect the transmission patterns of vector-borne diseases. It can affect mental health and well-being. There was somebody who had asked about that, so if we have time during discussion, we can talk about climate change and mental health. Drought affects food production, livelihoods, can lead to food insecurity and malnutrition. Flooding can increase the risk of diarrheal disease and vector and waterborne disease. Again, food insecurity and malnutrition. Actually, it sounds counterintuitive, but drought also can increase the risk of diarrheal disease and vector-borne disease, because if there's not enough clean water in terms of diarrheal disease, enough clean water for consumption or for water for sanitation and hygiene, that can increase the risk of diarrheal disease. Also, slower moving rivers and streams whose water table has dropped as a result of drought can actually serve as they're better as breeding sites for mosquitoes, because the water's not moving as rapidly and there's space and time for the larvae to be laid and hatch and mature. So, and air pollution, we talked a little bit about that in terms of asthma. There are other health risks that can be caused by that or exacerbated by air pollution. But and then if you can click forward once, Elizabeth. Thank you. So this arrow also shows that, these are all, for the most part, indirect effects on health with some direct effects. In addition, flooding, drought, other extreme weather events can also lead to conflict over scarce resources, can kind of force families to choose to migrate out or otherwise be displaced. And then in both cases, those events or those effects can directly disrupt, health infrastructure or access to health services, which then will further have a knock-on effect on health status. Next slide. All right, so let's zero in a little bit further because, we at Save the Children are focused on maternal and child health. On this slide, this repeats some of that previous content, but I wanted to include it because it gives some specific examples of how climate change can interact with and exacerbate some of the leading causes of maternal and child morbidity and mortality. So let's just take climate change out of the equation for a minute and say, for example, what are the 3 leading causes of death among children under 5 globally? Maybe I will just pause here for a second to see if anyone wants to speak up. Do you know what those are? Or you want to take a guess?
Isn't one diarrhea?
Correct, diarrhea.
Mm-hmm.
Malnutrition.
Malnutrition is an underlying cause, but not one of the top three. Well, the other two are pneumonia and malaria. So this is without climate change, right? Air pollution, which is actually a cause of climate change, is associated with increased rates, of pneumonia. Malaria vectors, we know, are shifting and expanding as a result, into previously non-endemic areas as a result of increased temperature, increased rainfall in places that didn't previously experience them. And diarrheal disease risks are increased, as we just talked about, under flooding and even drought conditions. So it's a real, we have big challenges that we've been working a very long time to resolve in global health, and we've made really great progress. There's more progress needed, but climate change adds an entire new layer of threat and complexity to achieving, our aim is to save the children, to ensure that, no child dies of preventable causes. So that's child health. We can also look at, for pregnant women, what are some of the leading causes of pregnancy complications and maternal death. Those include labor and delivery. Risk to women's lives and health during labor and delivery are high, particularly in low resource and low income settings where quality of health services may not be up to standard. Of course, we also know from experience and data in our own country that you can have all the resources in the world, and you can have available care that should be of high quality, but depending on who you are walking into that labor and delivery room, if you're a Black or brown woman in the US, your risks of labor and delivery complications are greater. So already underlying risk and challenges. Now add some of the effects of climate change. There are data that show that for pregnant women, prolonged exposure to extreme heat is associated with increased complications, including preterm labor and stillbirth. So these are already challenges in low resource settings. And now we are adding additional risk through their prolonged exposure to extreme heat. And so this is concerning. These are already the reasons that women and children are dying, and climate change threatens our progress and threatens to make these challenges harder. All right, next slide. All right, this is the promised pause point, and I will maximize my screen so I can see your faces if you choose to. So I just want to take about 10 minutes maximum, and Elizabeth is going to help keep to time, to hear from you if you have questions, reactions, if you want to voice anything that you put in the chat earlier, to what I've talked about thus far in terms of kind of why we consider climate change and health to be a climate, health, and equity challenge. Or examples that you've seen in your own life or your own work that sort of bears this out in your lived experience.
Well, I can start us out. I did have a question. So you did kind of talk about the socioeconomic trends that you saw on one particular slide, and I was wondering, like, especially during COVID-19, I read a lot of articles that was talking about how like the ecosystem was improving, and we were seeing a lot of like good directions in climate change. Did you see any of that in your own work, and also like some of those trends that we did see, could they have been sustainable if we had continued them?
That's such a great question. And before I directly answer that, I should mention something that just sort of scene setting here about climate change and climate action. There are you can conceive of two different paths that are not mutually exclusive to addressing climate change. The first is mitigation. So how do we as humans who are responsible for this, how do we mitigate? So how do we reduce our emissions of greenhouse gases? How do we, sequester or store some of those greenhouse gases? How do we, change decisions on a micro, meso, or macro scale about transportation, energy use, diet? There are all kinds of decisions and policy changes, you know, available to us to address, limiting and reducing greenhouse gas emissions. And then there is also a pathway that focuses on adapting to the negative effects we're already experiencing, right? And this is not just in health, this is across the board. So how do we anticipate and adapt to those threats? And again, they're not mutually exclusive. And hopefully, have our experience of those adverse impacts inform the need to take action to mitigate. So in the case of, during COVID, when so many countries were locked down, because many people who didn't have to travel for work or move, take a bus, drive, were staying home, that reduced the emissions of greenhouse gases. So we actually saw, I'm sure you saw those like before and after images of major metropolitan centers, particularly in Asia, like the air quality in Beijing, I think was like the best it's been in decades. So it did have an effect. It did not last. And, at a macro global level, in terms of how governments are approaching this existential threat, we have seen that the most recent climate conference was end of last year. And there still are, countries making really strong commitments. Some of them are moving to fulfill them. Others are taking their time. So the answer is yes, there was progress because we just had to stop moving around, or to understand what was happening with COVID. But that's a whole other line of work. And while some of our efforts and programming will touch on mitigation, and actually you'll hear about this later when I give some specific case examples, a lot of what I'm talking about today is primarily on the adaptation side. Because let's face it, it's already bad. Like, it's bad right now, as many of you shared, just the things that you've seen change in your lifetime. Last year being the hottest year on record globally. And even if we do, meet all of our Paris Agreement commitments on time, it's still going to get worse for a while before it gets better. So we have to be doing the work now to understand these challenges and to adapt and prepare to adapt in the future as they continue to get, this is the bad news, right? To get a little worse for a while before hopefully we get our act together and those start to go down. But thanks for the question, Tony. I don't know if I answered it.
Yes, thank you. There is a question in chat, and then also I'll go to you, Anya. Dina Harris said, I'm a senior, so I'm counting on the college age generation to come together to influence Congress in regard to climate change. Do you see that generation forming a movement of any kind, or is there too little interest?
That is a great question. And I'm not sure I'm the best one to answer it. Your generation is in between me and my children. So I have younger folks in my family who are in high school and middle school. I don't know. I'd be curious how you feel. I think there is interest from what I see from my kids, their peers, and kids around the world. But within this country, I don't know. Be curious what you think. Or even if you think there's not interest, is that a reason not to try?
Well, what I see, what I don't see are, for the masses of, marches, this is such a threat. And I don't see enough of the younger generation forming together to influence. I think of some of the Martin Luther King marching and the influence of large numbers of people, and that is the generation that will be the most influential. I'm not going to be around for another 15 years, but my kids and my grandkids will, and that's who I'm concerned about. Plus I'm concerned about the whole climate situation. But I can't form a group of seniors to go march on Congress.
Maybe just a quick reaction. Thank you, Dina. And I apologize. I misread your chat and was thinking you were a senior in college, which doesn't make sense because you're all in graduate school and you meant you're more senior in age.
Oh, right.
I read too quickly.
Oh, I'm sorry. No, I'm counting on that generation to form a large enough movement to influence Congress, because they don't care, it seems.
Well, I would defer to other students and colleagues here. I see Erin responding in the chat that she lives on the West Coast, and she's sharing a link to an example of youth activism local to her area.
Activism, yes.
Would anybody else like to respond who might be a younger generation and engaged in this space?
May I respond as an older generation? I'm a prevention-oriented geriatric neurologist. Therefore, I am concerned about saving the children so they can become our future elders. I'll ask my question. But yes, Third Act, I would point them out. Elders for Climate Action. There are some groups that are trying to engage and activate seniors, Dina. But my question to you, Rachel, is it does seem to me this is an intergenerational issue, and the energy of activism for elders, which unfortunately tends to be focused like through the AARP on their own self-interest, can be channeled with kids, youth, in a way that somehow it hasn't been. Do you have any perspective from your side about outreach towards, as Dina said, this important issue of engaging the seniors in this issue? Thank you.
Thank you. I think this is an excellent point. I don't have an informed perspective, except that I think more voices and hands are better. And just to acknowledge that, we have teams of colleagues within my organization that work on policy and advocacy and public campaigning, in the US and around the world. So, they're more grounded in what this looks like. But I again, I welcome others to share their perspectives on this. I see a few more ideas in the chat. And release your inner Greta. Sorry, Peter, that I don't have a better answer, but I think that's the best I can offer for now.
Anya, I think
your voice matters.
as well. Oops, sorry.
We are just about at 10 minutes time for this discussion, just letting you know.
Anya, did you have a question still?
Yeah, I did. I just didn't want to push us over time, so I can hold it till the end.
Okay. Go ahead, I think. Go ahead.
Okay. So you talked about inequity as a risk multiplier, which I thought was an interesting term. And you also listed a bunch of vulnerability factors. I remember like demographic, biological, socioeconomic, gender, and a couple of other ones. So thinking in terms of inequity issues within these vulnerability factors, which do you see in your personal work with Save the Children to be the most multiplicative in regards to risk on a global level?
That is a great question. I'm going to dodge it, but I'm going to meaningfully dodge it to make an important point, which is that, how we know this, right? Every country, every community is different. And so the ways in which, disability, let's take disability, for example, and gender, how disability and gender would affect a person in Silver Spring, Maryland, where I live, is probably going to be quite different from gender and disability considerations in South Sudan. To begin with, again, absent climate change, and then you add, the complexity of the additional sort of stressors that climate change brings to health for somebody who may maybe facing additional challenges, or the system may not be meeting those people where they are with what they need. It's going to be different. So I don't want to preference, one vulnerability or inequity over another. It's really important that we look at context in that case. Thank you that's a great question. And maybe I can unpack that a little bit more when we get into the 3 case examples that I'll share.
Oh, I think you're muted.
How did I mute myself? Okay. So we need to move on. Did you hear my answer? Okay, good. I wasn't soundlessly talking to you that whole time. All right, so the fun stuff, to the promise and to what we hope to achieve. You can go on to the next slide, please, Elizabeth. You got a sneak peek of this one earlier. So, admittedly, still at a global level, before we get down into some specifics, what are we trying to achieve as Save the Children and many other organizations working with similar missions? So for us, given our global health ambition that I mentioned earlier, is that every child has a healthy start in life or doesn't die of preventable causes before the age of 5. What we're trying to achieve is we want to protect the progress that we've made in bringing down maternal and child mortality significantly over the last 40 years. So we want to protect that progress, and we want to support families, communities, countries to reduce or prevent the adverse impacts of climate change on their health. So to achieve these grand ambitions, we believe that we need to achieve the following. We need to realize stronger, more resilient health systems. And that would be, health systems that are able to, understand the relationship between climate change and health, that can effectively anticipate and manage climate risks, particularly for vulnerable populations, for pregnant women, mothers, newborns, young children, adolescents. So we need strong health systems that are resilient. We need communities that have, the knowledge, understanding, capacity, and resources to prioritize action on climate-related health risks, actions to reduce their risks, at home, to the extent that they have control over some of those factors that lead to the health risk in their homes and in their communities. And we want those communities to be partners in taking action. So this is not a top-down or government-only solution that's needed. We need communities to be engaged, resourced, and able to respond. We also need, back to Dina's point about how do we get Congress to change or to listen. That's a question in many countries. So we need national policies and strategies and action plans, and subnational policy strategies and action plans that again reflect an understanding of how climate impacts health. And those plans should effectively guide public service provision, public investment in public services. And then last but not least, we need the voices of children, of other disadvantaged groups, women, elevated and audible and amplified within any conversation about policy change, again, at a local level up to a national or global level. Next slide. So this is a little bit busy, and just bear with me while I walk us through this, because this will inform some of the case studies that I'll share next, which is really the best part of this presentation. So, how do we go from knowing that we need stronger, more resilient health systems, capacitated communities, et cetera? How do we move from those desired impacts to actually doing the work? First, we think that we need to understand, the barriers that exist. And again, I'm presenting this to you in a global sense. How we would apply this and look at it in a given country context will differ. But we have identified sort of 5 key barriers that we think need need to be overcome. And as a result, we came up with these 5 as a result of really in-depth collaboration and consultation with colleagues in countries around the world, and in a review of both peer-reviewed and gray literature to understand barriers in this space to effectively addressing climate health and equity together. And so these barriers and the pathways that I'll quickly walk us through, these underpin our organization's strategy, which I think just took effect in 2022. So it took some time to develop, and now it's in effect, and it's guiding our actions today. So if we look just briefly in the upper right-hand side, limited awareness, that kind of red, rusty brown color, we think that one key barrier is limited awareness of these relationships. And maybe I should pause here and say too, none of this presentation is meant to suggest that we drop everything else we're doing in health and only focus on climate change. Like, we need to keep our eye on those balls. We need to keep attention to those leading causes of death, but we also need to understand how climate change is going to is complicating and will complicate our ability to intervene and bring down those rates of disease and death. So we want to overcome limited awareness of the relationships between climate and health and social determinants. And that is within ourselves, within Save the Children, within our offices in DC with, I spend a lot of time working with colleagues in our sort of thematic teams. So adolescent health, nutrition, who are experts in their own, daily work. So we're working in partnership with colleagues to together, because I'm still learning, we're all still learning, unpack some of those, understanding some of those impacts and interconnections between climate health and equity. We also need to, moving on to the red one, overcoming, this is kind of development speak, inadequate recognition of co-benefits. Basically, to overcome this inadequacy, we need to partner with others to develop, test, and implement interventions that both address climate change. So some of that mitigation work that we talked about in response to Tony's question, and adaptation and prevention work together. So looking for ways to, get more bang for our buck and for our efforts, basically. The orange at the bottom, decision-making silos. This really gets into the weeds of development, but basically, in most countries, as in the US, the way governments are structured and their public services are structured is, by technical area or by thematic area. So, a Ministry of Health in a country, if they want to be taking climate change seriously, they will need to work with colleagues in the National Meteorological Office, which is probably not somebody the Ministry of Health has ever really worked with before, to understand data on how weather patterns are changing in their context as a result of climate change, to inform, anticipatory action, to prevent exposure, to limit exposure to different hazards. So, Ministry of Health, National Meteorological Office, those aren't necessarily places where there have been sort of natural relationships in the past, and where they have each made their own individual sort of decisions about policy and direction. Similarly, like the Ministry of Environment might be somebody that the Ministry of Health would need to work with. So basically, understanding that we can't work within our silos, within just our individual sectors. We have to work in a multi-sectoral fashion, which is way easier said than done. So we're looking at, okay, very practically speaking, what are some of the elements of overcoming those silos in a given context? On the left-hand side, limited community participation. Again, this is sort of the bread and butter of a lot of our work at Save the Children. That adage, nothing about us without us, we absolutely believe in. And we want communities, particularly vulnerable members of communities, to be front and center in identifying challenges and solutions. And then finally, inadequate resources. Well, this is where advocacy and policy change come into play, and where, Save the Children is doing a lot of work to try to advocate for increased climate financing related to health. All right, next slide. All right, so now this is the best part. We're going to walk through three sort of case studies from three very different contexts. And you can go on to the next slide. All right, so first of all, we'll start in a small landlocked Southeast Asian nation, the Lao People's Democratic Republic, or Lao PDR, which is a country that's facing significant vulnerability to climate change. They are projected to experience heightened climate extremes, including a 2 to 3 degrees Celsius increase in temperatures, in average temperatures, by 2050, and a potential 10 to 30% rise in rainfall, particularly in the southern regions of the country. And here it's notable to be aware that more than 50% of the population, it's not a big country or big population, but more than 50% of it lives in the tropical lowland plain and floodplains along the Mekong River and its main tributaries. So high concentration of population in the more climate vulnerable areas of the country, which are projected to experience a lot of climate hazards in the future. And so when we look ahead and think about how these climate shifts are going to direct the health sector, we're concerned about the frequency and intensity of storms, extreme weather events, which will likely cause damage to critical health infrastructure. We've already seen this, and we expect that to continue. We also are expecting to see a proliferation of disease, particularly dengue transmission, dengue fever, and diarrheal disease, which in and of themselves are, health impacts that no individual wants to experience, and we want to help people prevent them. They also, in aggregate, significantly burden a healthcare system that's already not particularly well resourced and has some weaknesses. So with all that context in mind, this is an actual real program that we are just getting started now. It was approved last fall. It's a partnership between ourselves, the government of Laos, where we're working with Ministry of Health and Ministry of Natural Resources and the Environment, I believe, WHO, Healthcare Without Harm, and facility staff and communities, to focus on 100 facilities that are in the most climate vulnerable areas of the country, and in rural districts, where, again, their sort of baseline infrastructure, baseline health information systems, baseline human resource capacities are low. And so what we're going to do over the next 5 years is work together to develop improved early warning systems for dengue fever. So that requires improved disease surveillance, information and reporting systems at facility, between facilities, with communities. There's infrastructure upgrading for water, sanitation, and hygiene infrastructure, both to improve the structural resilience to extreme weather and also to support them reducing the spread of diarrheal disease when there is extreme weather. Working to strengthen the knowledge and skills of healthcare workers related to climate-sensitive disease risks, and engaging communities, again, so that they can be part and parcel and at the center of co-developing action plans for themselves to prevent health risks. And then last but not least, this is really exciting. This is one of those examples where we are supporting government to hopefully shift to more sustainable and renewable energy sources, so solar panels in this case. All right, next slide. Then to Colombia, in the northwest corner of South America, where current and projected climate hazards include, again, more extreme weather events, greater temperature extremes. For them as a coastal country, both on the Caribbean and the Pacific Oceans, they are projected to experience, and they are experiencing and projected to experience sea level rise, ocean warming, as well as, reduced precipitation in some areas and increased rainfall in others. In Colombia, sort of the issue that we're looking at addressing together with partners is the effect of climate change on food insecurity and malnutrition, particularly among pregnant women, breastfeeding mothers, infants, and children. So in Colombia, 30% of the population is already considered food insecure, and climate change is worsening that. And so the activity in this case is not a big, well-resourced 5-year Green Climate Fund project like in Laos, but a really small pilot activity that we've started, building upon really excellent community health systems work we've done previously. An activity to really meaningfully engage really community members in these big questions and big issues related to climate change and health. And so here we are working with the communities in Riohacha, which is in the north, in La Guajira, along the Caribbean coast and the border of Venezuela, and then Buenaventura, which is down in the southeast along the Pacific Ocean. And so working in these two specific communities, so getting out of the global and down to truly the local, we've engaged indigenous populations, which are different in each of these two areas, Afro-descendant populations, which is the term that they use, Venezuelan migrants, because there are many Venezuelan migrants in Colombia, adolescents, and other individuals that are, facing marginalization or are vulnerable in their contexts, and as well as community-based organizations, municipal leaders, et cetera. We've brought these folks together to unpack, what is the relationship between climate change, food security, and nutrition for them in their contexts. Next slide, please. And we'll just go ahead and click. So I'm just going to say that this is a messy spaghetti bowl of a causal loop diagram. We call them systems maps. And I won't dwell on this. I just wanted you to see that what you see on this screen is the literal visualization of the various, climate, food insecurity, health, malnutrition, and equity interconnections that were identified in Buenaventura by the people who were in these sessions. And if you go on to the next, if you just click through to the bubbles, I'll just draw your attention to one aspect of this, and you can spend more time afterwards looking at this. So, with regards to climate change in the upper left, it's driving a number of these factors. But I wanted to highlight the ancestral practices bubble, which I think is really just important to highlight. Some of the indigenous participants, highlighted that how changing weather patterns are threatening, their ability to use some of their traditional agricultural practices, or how climate change is affecting their access to clean or sufficient water to undertake those, to perform agriculture, which is obviously a challenge and a problem. But there's a flip side to it as well, which is the point of this exercise. It's not just to identify the problems and the relationships between them, but to understand, how we can take action. And so in the case of indigenous communities, there's a growing body of research on how many traditional indigenous ancestral practices in terms of land use, in terms of agriculture, in terms of using native cultivars are actually, more climate friendly than more modern methods, and that they can also help preserve or restore soil quality and fertility while also providing nutritious food to communities that need, maybe improved dietary diversity or more micronutrients. So it's a challenge, but it's also, there's a solution in there that we don't want to lose track of. So that's why we need to engage these community members in identifying challenges and solutions together. So the next phase for this work, we've done all the problem identification, and now we get to move on to solution identification, which will start this spring, which is exciting. So stay tuned I can share back at some point if you're interested in what they come up with. All right, last slide, and then we'll discuss further. This last case is Somalia, and there's a lot that I could say about Somalia, but I'll try to keep it brief. You know, this is a country that's among the most climate vulnerable in a biophysical, natural sense in the world. And it's also one of the most fragile countries in terms of, you know, governance and security. It's also a country where cultural and gender norms often limit the agency of women and girls. And, you know, because of these factors, and including a weak health system, Somalia continues to have exceptionally high rates of maternal newborn child mortality, again, from causes that should otherwise be preventable. And so within this context, Save the Children does a ton of health programming and resilience work across the country. And so the small slice of it that we're looking at from a climate and health perspective is, how can we take this context and, you know, kind of not well-resourced health facilities that are not able to provide, you know, services at all hours, which is important because they don't have energy, they don't have reliable energy. Services at all hours, especially during the night, is particularly important for women who are in labor because babies don't decide to get born during working hours. This is true worldwide. So is there a way that we can take all the big challenges that Somalia faces and find a few solutions that might cross over some of those challenges to realize some benefits? We're not gonna solve all these problems, but we are hoping to, through partnership with the government, with communities, with the private sector, with other NGOs, identify how to bring more renewable and sustainable energy to health facilities, which currently have, you know, many of them do have solar panels. Some of them are of good quality, some are not. Some haven't been maintained well over time. There are patchworked electricity grids, microgrids, and then there is a significant reliance on diesel-powered generators, which is bad for greenhouse gas emissions, bad for spewing pollutants into the air, which is not good for human health. So we're putting together this pilot to renewably power some health facilities, and it's not that simple, but in total, we're hoping, you know, this will reduce some greenhouse gas emissions, contribute to elements of improved service availability, which will realize some health benefits in combination with lots of other interventions. It's not just us or just this. Improve community access to renewable energy, which doesn't currently exist, and leverage new partnerships. And before I close here, I'll just say, again, because, you know, Somalia is one of those countries that is suffering the most from climate change and has arguably contributed the least to its causes. So this is really an important opportunity to support what's often termed a just transition to renewable energy. You know, I have solar panels here on my house in Silver Spring. Great, good for me. That opportunity should be available to the poorest of the poor, and even in difficult humanitarian contexts. So with that, let's open it up for questions and discussion. I think we only have about 12 minutes. I apologize for going a bit over.
All right, thank you so much, Rachel, for your discussion. So we're gonna open it up for happy students first, and then we'll go to the wider audience.
So maybe while our students are formulating their questions, I'm sure they have some. Let me just ask kind of a broad question. So if you look at the public face of Save Your Children, a lot of it focuses on, you know, acute aid for displaced populations and disasters, et cetera. And you're revealing here like a much deeper effort to look at causality and answers to future problems. And how does the organization parse out what they do in those two areas and look at their kind of resources? That's a broad question, but you know, a quick answer maybe would help me understand Save the Children better.
a great question. Yeah, we do a ton of this systems-based development work. You know, it's complex and wonky and on a slower time scale, and you know, isn't the acute emergency that requires public funding, private funding, you know. So I think you do see the public face, and this is, I know that Lynette Golding, who's a good friend and colleague, is on this call. This is often a challenge for those of us working in, you know, on the technical side of programs, even for our humanitarian colleagues. But, you know, especially on the development side, it's a hard story to tell. And, you know, most of the resourcing for this complex work comes from institutional donors, comes from USAID, other, you know, other governments, you know, equivalents of USAID, private sector. So, yeah, it doesn't show up on our website well, but this is very much, you know, part of our DNA for development programming.
Thank you very much for that.
Dr. Whitehouse.
Well, I want to first encourage the happy students. Come on now, guys, it's your turn. But I'm participating in a conference on regenerating bioregions that's actually focusing on Colombia and the Barichara River. The question for you is, as Save the Children works around the world looking to balance adaptation and mitigation, do you think this idea that we have to think of ourselves not as political units, but as ecosystems, as bioregions, and that we should put our resources into saving the children, and all of us focus in that different way that says, let's work with Mother Nature to figure out what we need to do to live in a particular place, which respects in many ways the indigenous populations that have been doing it better than we have for years, decades, centuries. Thank you.
Thank you, Peter. I think I lost the question in there. Myself as an individual, as a master naturalist, which is a very lofty term, I believe that we do need to figure out how to live in better balance with nature, because our life literally depends on it. Our human systems depend on natural systems.
I don't want to confuse, it's bioregions. I don't know if that's a concept that you use in Save the Children, but the notion that we have to think of ourselves as living in not just a local community, not just a planet, but some unit that we can relate to in nature. So that was the question. Do you think in bioregions that Save the Children?
I myself am not familiar with that terminology, so I will be interested to look into it. Thank you.
Margot.
Hi, and thank you for coming to speak with us. This presentation was really great. I was just wondering, in terms of some of the examples of the interventions that you mentioned, if you've seen any similar interventions be applied or like mirrored in the US, especially in like more low-income communities here. Because I think a lot of these interventions are really innovative, and I wonder if they're being applied, or like how to sort of galvanize local governments to do similar things if possible.
Thanks, Margot. That's a great question. I know that in general, yes, there are initiatives underway in a lot of major US cities to look at, the first thing that comes to mind is how to mitigate, and here I mean like not greenhouse gas emissions mitigate, but how to mitigate the risk posed by extreme heat in urban environments where actually the temperature that you experience there is higher because of what's called the heat island effect, the urban heat island effect, which results from extensive surfaces covered with asphalt, less tree cover, less vegetation. So that's one. There's a lot of work underway in that space to green cities, like literally, to improve roofing material to reflect more heat, and to situate those interventions in the communities that are the most have been most disadvantaged by the system. So I'd be happy to share afterwards. I'm part of a kind of a working group of colleagues, some of whom are global health folks, others are working domestically in the US, who are doing a lot of really cool work in that space, including a woman up in Buffalo. I'm happy to share afterwards via email some of those resources.
Anya?
Yeah, hi. Sorry, this is not a super high level question. I might have missed it in your presentation, but when you were talking about the intervention in Somalia, you mentioned supporting behavior change. And I was just wondering if you could expand on what exactly you meant by that.
That is a fantastic question. And in that particular case, we don't have a behavior change sort of intervention identified yet, but I think what I referenced.
Okay, at least the request is done.
What I was referencing was, appreciating that there are significant underlying social and gender norms related to that affect women's and girls' agency. I think, you've actually got an expert here who I think is already or will be teaching one of your classes, Dr. Lynette Golding, who I've learned so much from on the SBC front. So just in the interest of time and in the interest of her expertise, I might defer that to her more generally. But certainly there's, again, this is a pilot, so we're just getting started, but there's other work underway in Somalia that absolutely does take SBC into the core design of our interventions. And I can also share a few examples of that afterwards. Thanks for the question. I got to write down what I'm offering to share so I don't forget.
I kind of had like a broad question. I've seen a lot of like initiatives specifically on like companies or corporations that they'll say that, we're going to be green in like 2050 or, by 2030. Are those timelines more realistic, or do we need to push for, change in the next 10 years or actual timelines of how they're going to do this?
Great question. A couple of different answers. I think, some of the language you hear about 2050, that's tied to the commitments that countries have made to the Paris Agreement, which is most countries in the world, and that's supposed to guide our, individual and then collective efforts to reduce greenhouse gas emissions, both as, in terms of government, but then encouraging private sector and putting private sector on notice that they have a responsibility, that they need to help us meet those goals. So 2050 is sort of that global milestone. It's also the point at which, a number, I can share this as well afterwards. This is like way deep details, but there is really excellent science and predictive modeling of, for different scenarios in terms of the level of greenhouse gas reduction we reach, what that will mean. So if we go up to 1.5, if we go up to 2 degrees Celsius, if we go up to 3 degrees Celsius above pre-industrial levels, what that will mean in terms of, various impacts, health and otherwise. So a lot of those have 2050, as sort of the milestone. And so by 2050, if we do or don't achieve different levels of reduction, this is, basically how bad it could look. So that's driving a lot of those commitments. And then, 2030 is the expiration date of the current Sustainable Development Goals, which do drive a lot of, for Save the Children, our own global goals. So that's, you'll often hear 2030 because we have goals to reduce mortality by 2030 that we really want to meet. All right, and I know we only have 1 minute left and it's a hard stop. So would it be okay if we just, I just wanted to share one thing in closing. And it's a little bit, well, it's not cheesy. I actually mean it genuinely about hope, because a number of you in your survey responses, kind of noted your grief or despair or depression over, the state of the climate crisis. And how can we really make a difference? You know, what if corporations are not upholding their end of the bargain, which many of them are not, fossil fuel companies are not. You know, somebody asked me what gives me hope. And I am an optimist, so that's full disclosure to begin with. I believe that if we made this problem, you know, inadvertently over time, we can fix it intentionally. And I also think that we've been talking at such a global scale. I wanted to share with you the voice of one individual child through one of our campaign, Save the Children campaigns. We interviewed children all around the world about their hope for climate change. And I think that if this young girl can take hope and take action, albeit, you know, small, that all of us should, you know, take hope and take action. So if Elizabeth, you're able to share this. And if it doesn't work, I can figure out how to send the link afterwards.
Okay, we can bear with you for a couple minutes if it takes it to do this. I invite people back next week for a talk on an RCT in Congo of water and sanitation efforts. So a related topic. I hope many of you can come back. Rachel.
Thanks, Elizabeth.
إذا بدي غير المناخ وخليه يصير طبيعي. إحنا بنحب نزرع ونسقي وهيك والطبيعة لأنه نحن بنحب الخضار. كل صيفي نزرع شكل وشتوى نزرع شكل. أنا أكثر شيء بحبه السمك والحرث. بهتم بالطبيعة وبسقيهن كتير. يعني الخيم شكله مو حلو وبكان الكابوس هو بيكبر بيغطي الخيم كلها. أنا عم بسقيهم مشان يفتحوا كل يوم الصبح.
All right. Well, with that, yeah, if Iman can plant and beautify her life around a refugee tent in Syria, I think that we can take even small actions as well and not lose hope. So thank you all very, very much. I appreciate your time and happy to be in touch over email to follow up with anyone.
Thank you so much, Rachel.
That was great. I hope to learn more about your master naturalism at some point too. So it was a great session, and I thank everyone who attended. Thank you, Tony, for moderating this session, and we'll see you all next week.
Thank you.